I am 31. I was diagnosed at the age of 26 with autism and ADHD. And in 2020, amidst the global pandemic, I was sectioned 3 times under the Mental Health Act. The first 2 times was with police, and on the 3rd occasion, I was put onto a psychiatric ward. Unfortunately, the treatment that I endured and the things that I went through whilst in inpatient care were very much adverse to my needs and very much exacerbated what I was actually going through at that point and pushed me further into a crisis moment. There's a real lack of understanding of autistic people, a lack of understanding of particularly female autistic people and those of ethnic minorities, such as myself as a Black British Caribbean woman. I felt that the treatment that I received was adverse to what I needed and it exacerbated my conditions at the time. I was put on a psychiatric ward with around 16 to 17 other women who had varying needs and what seemed to be much more serious than what I was going through at the time. It wasn't the best place for me. I was surrounded by people who were going through visibly and audibly much different experiences to what I was going through. I was sedated, I was drugged, I was restrained. I was forced into situations where I was surrounded by all of the other women on the ward at the same time. For example, at times when I would need to eat, which I already find really distressful. So being in an environment where there are a lot of strangers, a lot of smells, and a lot of other bodies that I'm just not used to, it makes things more difficult for me. Following on from being discharged from the inpatient unit, I received no follow-up care, I received no support in the community, and to this day I'm still struggling as a result of what I went through at that time. I wish this Train the Trainer programme was running at the time of me being admitted into inpatient care. I feel that the professionals would have known how to understand me a lot better and how to work with my challenges and my differences to the benefit of everybody, instead of exacerbating the crisis that I was already going through.
I am autistic and I have lived experience of my own mental health needs. I think it's really important that trainings about autism are co-produced and co-delivered with autistic people. I feel that this really adds layers and depth of understanding and experience. It allows the training to go beyond the facts and go into real life situations of what it may feel like, what the impact may be. And autistic people just have that area of understanding that professionals can research and learn about, but they can't live. And so autistic people are there to say, this is how it feels, this is how you can help us. I'd really like to see in the mental health system change around communication with autistic people. So that could be something like making sure that language is age appropriate and accessible, especially around early diagnosis and the early stages of being diagnosed. So, for example, when I was diagnosed with autism, I was spoken to an hour before I got diagnosed and went in to have my assessment results, and then maybe 20 minutes after, by the same person, and the way I was spoken to was completely different. Before I was spoken to like any other teenager, which worked fine for me. And pretty much immediately after, I was spoken to in a way that was very, very young and very infantilising. And this really shaped my relationship with myself and autism and being autistic, because this was the first experience I had of being spoken to as almost an officially autistic person who'd been told, yes, this is the situation. I got spoken to like a small child. I was 16, no 16-year-old wants to be spoken to like they're 2, you know. So it's really important to have communication as at an appropriate level. I think it is really important to have trust, especially in an inpatient setting where you may be spending longer and more time with direct contact with people, such as therapists or nurses. And I feel that those employees can, mental health professionals can do certain things to gain that trust, such as finding out who you are and what you enjoy and trying to find ways to reach out and connect with you. As an inpatient, you might not always want to be the one initiating these relationships and positive experiences, so it's really important that staff are able to do this for you and with you.